Alright, so now I'm going to perform foot care. I have 2 washcloths, one to wash, one to rinse, a hand towel to dry, and a bath towel for my barrier, and soap. Good morning, Amanda. My name is Kathy. I'm going to be your nurse aide today, and I'd like to go ahead and provide foot care. Okay, so I'm going to provide privacy. I've already washed my hands. Amanda, if you could go ahead and sit up at the side of the bed while I go get the water. So here, I'm going to turn on my warm and my cold, my hot and my cold. I'm going to put my gloves on. You feel for the water. I like to feel either with just one little tiny pinky or my wrist after I have my gloves on, so that I've got the temperature, the right temperature. Okay, so this is the right temperature. We're going to go ahead and fill it up. It's a little warm. We'll go a little warmer. All right, the temperature feels good to me. So, Amanda, I have checked the temperature. Would you please check the temperature?
Feels good.
Okay, so I'm going to put a barrier down. Would you remind, let's see, which foot would you like washed?
Right foot.
Right foot? Okay. So would you mind removing your sock? Let me just put this barrier down for us. Okay, that doesn't bother you. Okay, and you've already checked the water, and I've checked the water. Let's get all of our supplies down here. Oh, I need one more supply, so let me grab that. We'll need lotion. So if you forget a supply, you can just grab it because you're considered to be in the same room with the client. So, okay. All right, so let me first of all put your foot in the basin. Cute little pedicure there. You have. And now I'm going to get your foot wet. And I'm going to lift your foot from the basin, get my washcloth wet. Actually, I guess you can put your foot back down until I get my soap on. So you want to keep your soap free, your basin water free of bubbles as much as possible so that you can still use it for rinse. So I'm going to lift her foot up, and I'm going to go ahead and just wash her foot. So I'm going to wash the bottom of her foot, the top of her foot. I'm going to wash her toes and between the toes. Each toe has to be washed. Okay, so I've gotten her whole foot. I'm going to go ahead and throw this in my hamper. I'm going to stick your foot back in the water, and now I'm going to use a washcloth to rinse the foot, and we're going to rinse the entire foot, including between the toes. Okay. Okay, so we got your foot all rinsed. We're going to put that in my hamper. I'm going to lift your foot out, and I'm going to dry your foot. Okay, the whole foot, including between the toes. Okay, I'm going to put some lotion on that foot. And we do not put lotion between the toes because it can cause skin breakdown with the moisture. So not between the toes at all, just the top and the bottom of the foot. How does that feel? I'm going to remove any excess. Does that feel good? I'm going to put that in my hamper. Now I'm going to get rid of my supplies. I had this all in my clean barrier. If you can go ahead and put on your sock, I'll go ahead and empty the water. So I'm going to take my supplies back, just set them down, pour the rinse out, rinse the basin, dry the basin, okay, put it in the designated dirty area. I'm going to remove my gloves without contaminating myself. Wash my hands. You have your call light and unside privacy. I'm going to make sure the bed is safe, low, and locked. End of skill. Wash hands.